All right, you're watching KUTV Primetime News, and we are back with an interesting conversation about our nursing officers. And according to Britannica.com, nursing is a profession that really takes care of the people that are sick, that are injured, disabled, and those who are actually dying. Nursing is also responsible for encouraging the health of individuals, families, and communities in the medical and community settings. Nurses are actively involved in healthcare, research, management, policy deliberations, and patients' advocacy. International Nurses Day is celebrated around the world every May the 12th, the anniversary of Florence Nightingale's birth. You may be asking, who is Florence Nightingale? The history of professional nursing traditionally begins with that name, Florence Nightingale. Nightingale was a well-educated daughter of wealthy British parents who defied social conventions, tending to injured soldiers in the Crimean War in 1850s, and played a significant role in changing the nature of nursing profession in the 19th century. This year's theme is Our Nurses, Our Future. For a detailed conversation around the nursing profession, I am joined by Caroline Wachira, a senior nursing officer and National Nurses Association of Kenya Chair, KU branch. Caroline, if you can hear me, good evening.
Hello.
Hello, Caroline. Can you hear me?
Yes, I can. How are you?
I'm okay. How are you this evening?
I'm well, thank you.
Karibu sana to the conversation. Now, begin by telling us, what does it, even as you tell us who you are and what exactly you do, what does the work of a nursing officer entail, and what can one do to make sure they join that particular profession?
Okay, my name is Caroline Wachira. I am a nursing officer at Kenyatta University, and currently I am the chair National Nurses Association of Kenya, KU branch.
Amazing. So tell us, what does it take for one to become a nursing officer?
You can become a nursing officer by 3 categories in Kenya. You can be an enrolled community nurse. You can be a Kenya registered community health nurse or a Kenya registered nurse, and you can also be a Bachelor of Science degree nurse. So it will depend at your entry level. So you can become a nurse by being a certificate nurse. You can be a nurse by being a diploma nurse, and you can also be a nurse by being a diploma nurse, a degree nurse. So you have 3 categories of entry to become a nursing officer.
All right, thank you very much for that. Now, the work of a nursing officer is tasking, and that is no debate, especially for those who have gone to hospitals and have seen the work of nursing officers who do this kind of job with great sacrifice and commitment. What are the unseen challenges behind the veil as far as nursing profession is concerned?
Okay, thank you so much for that question. The nursing career has so many challenges, especially currently with the issue of devolution. We have seen a lot of shortages in terms of nursing employment in our institutions, whereby you find, according to WHO, there should be around 250 healthcare workers in 100,000 population. But you find, like in our situation in Kenya, we have about 103 health workers per 100,000 population, which is way below what is recommended by WHO. So one of the biggest challenges we are facing in healthcare is a shortage of nurses. That is number one, because of the government is no longer employing. The other challenges we have also that leads to these shortages, whereby we find we have a lot of old generation nurses. So we have so many nurses retiring, and the government is not employing. So the workload for the nurses currently at work is so much and the number of patients continue increasing every other day. So our biggest challenge is the issue of workload, shortage, lack of enough infrastructure in hospitals, lack of equipment, lack of medical supplies, both drugs and non-pharmaceutical products. So you find the nurse want to work, but the challenges at work are just enormous.
Let's talk about another challenge that we have seen, especially over time with the industrial action and the strikes we have seen from the health department. We have seen nurses over time through their associations go into the streets and call out for the government to listen to them, especially as far as wages is concerned. How would you say where are we at now in terms of the welfare of nursing officers, especially when it comes to matters of the pocket?
The challenges of the nurses, as I had mentioned earlier, is remuneration for the nurses has not been very, very good. And this is not something that has happened right now. It is something that has been there. And with evolution, things did not become better. In fact, things worsened, whereby you find where there was a lot of structure previously with the Ministry of Health. With devolution, you discover that every county runs the Department of Nursing on its own. So whereas previously there was structure, in a way, you qualify as a diploma nurse, you go licensing through the ranks. After 3 years, you get promoted. After 3 years, with some more education, you get promoted. There was complete structure of how you progress in your career, and the way you used to progress is the same way your remuneration was. But these days, you find with the devolution, that structure is not very well adapted in our counties and in our healthcare system. So you discover that progression is missing. So you find a lot of nurses sticking in one job group for the longest. So you go to school, they have better qualifications, they have better papers, but the remuneration does not commensurate the papers these nurses have. So you find there is a lot of dissatisfaction, and of course now that leads to the industrial actions. And as I had explained earlier, the number of nurses vis-a-vis the workload, the number of nurses working are few, the workload is more, and the remuneration does not change. So such kind of factors are those ones that continually lead to this unrest that you see.
All right. Over time, we have also seen our nursing professionals going abroad, especially the US, Canada, and other countries, to work abroad where opportunities are better in terms of wages and welfare generally. And we have lost some of our best nursing professionals to those particular states. Do you see any hope in the future for, things getting better and our nursing professionals being comfortable in their own country?
That is something that we are hopeful, but I can tell you it is a long, long journey. We will have to walk a very, very long journey, considering that instead of things getting better, because before devolution, healthcare was managed better to include the workforce and the human resource issues. But with devolution, you find that things are not getting any better. In fact, we are going back to where we were many years ago instead of making some very good progress. So you discover for us to get to where now nurses are moving to other countries because there are greener pastures there, to be able to improve our situation so that we are able to retain our good nurses. It will take a lot of goodwill from our government, a lot of goodwill from the county governments, a lot of goodwill from the government structures overall, the people who are responsible for the structures in terms of employment. Because if the standards remain the way they are, I can assure you that the nurses will always look for greener pastures, because as you have said, nurses in Ireland, Canada, USA, UK, they are well appreciated by their governments. But us in our African context, and especially Kenya, we are very well qualified, but I can tell you we have a long way to go before we get there. So our future in Kenya as a career is threatened. Yes, it is threatened.
All right, and I hope, and we all hope that we can do something about that, because health is really crucial. And talking about the crucial nature of health, let's go globally as we come to the close of this conversation. And we have seen the likes of COVID-19 come to us and affect the whole world. And nursing professionals were on the forefront. Once again, whenever it happens that a pandemic attacks a segment of the world or the whole world, and a number of them lost their lives. A number of them went into ICU and HDU because of close contact with the patients. A number of issues that really came up during that time made us ask ourselves a lot of questions about the safety of our nursing professionals and the health of our nursing professionals. And as we continue to enhance technologies all over the world as far as global health strategies are concerned, how would you want to envision the future? If you are placed in that particular seat of decision making, how would you want to advocate for nurses, even as we look forward to combat even more diseases that affect us globally?
What I can say is, in fact, the Kenyan nurses are in great demand out there, because basically the kind of training that is offered is a very rounded training, because Kenyan nurse leaves a diploma the Kenya Medical Training College as an all-rounded nurse who can work in communities, who can work in the maternity wards as a midwife, who can work in the hospitals, the major hospital as a registered general nurse. And meaning this is an all-rounded nurse who can work globally anywhere. And that is why you find the nurses trained in Kenya are in high demand, because the structures that has been there, the structures put in place previously have worked so well for the training of the nurse in Kenya. But you discover with time, there has been so many mushrooming institutions that are training nurses. You find that a lot of institutions training these nurses do not have the capacity to offer the clinical skills needed. And some are subdividing the nursing specialties into very small divisions that are not all-rounded. So you discover once these nurses qualify and they go out there, they are not able to work as an all-round nurse. So that decreases our demand even out there globally. So if I am in a position of policy setting in this country, what I would advise is that we ensure we do not destroy what we have built over the years. If it's the training institutions, they should continue training an all-rounded nurse, and then they decrease the number of people who are not well certified by the Nursing Council to train. We reduce the number of quackism. We also increase the number of clinical instructors in the areas that nurses goes for practicals, so that by the time this nurse is done, whether with a diploma nurse, whether a degree nurse, they are all rounded, they are well, they have all the clinical skills needed, so that that picture painted out there by the skilled nurse coming from Kenya is acceptable the way this nurse has been acceptable before. But when you find what is happening with a lot of colleges trying to train nurses, they are not sure what they are training. At the end of the day, we are diluting that nurse who was highly regarded previously. Because when you find now these nurses practicing in the field, they do not have the skills 100% because the training was not adequate. So I would wish that the government maintains the training of the nurses to the Kenyan Medical Training Colleges and the institutions that are certified by Nursing Council, and also in our universities. But any other institution that do not have the prerequisite requirements not to train, because that is where we are. They will destroy the career of nursing. Right. Yet there are government institutions and universities that are doing a good job.
All right, thank you very much. I agree, nurses are doing a great job. We have seen nurses during this particular week instead of going to celebrate, they actually went to give more support to the communities. And that reminds me of my mother, who is a retired nursing officer, who is still providing health or services in the community. Big up to all the nursing officials. As we wind up, I want to give you 30 minutes for the sake of time for you to celebrate from a leadership position, from 30 seconds, I beg your pardon, to celebrate your own people this particular time.
Okay, thank you so much. I want to celebrate my colleague nurses from the Directorate of University Health Services. I want to appreciate them for the good work we have done for our celebrations for the Nurses Week. We were able to go to Kenyatta University Primary School, and we were able to teach them on menstrual hygiene, dental hygiene, and we had a mentor from the Department of Career Development who gave them a talk on career and how to prepare for their exams. And we were also able to donate some sanitary towels, some boxers and panties, and a toothbrush and a paste. And we really felt that sometimes people do not understand us because you only see us in a clinical setup. And we wanted to touch the community around us by just showing compassion. And we were privileged to be at KU Primary School, where we were able to share with them the little we had. So I really want to appreciate my colleagues for the gesture and also the university management, because if were it not for them, we would not have been able to extend our hand to the needy at KU Primary School. And we hope that in the future we shall be able to engage more and be able to do more community service so that the people can see the compassionate side of a nurse, not only from a clinical setup, but from a community setup.
All right. Thank you very much, Caroline Wachira, for joining us tonight. It's been a pleasure.
Yes, thank you so much.
All right, we come to the close of our conversation. That is Caroline Wachira, Senior Nursing Officer, who is also NNAK Chair, KU Branch. Kudos to all the nurses, including my very own co-host, who is coming back to the